I was very shocked how long it was.
I was never myself having such a date.
I just talked about it. Yeah, that is very bright. Did you ever try to do using the new using the letter to write down your orders?
Yes, it was just too long ago.
That was one of my favorite stuff. And then I'm fine now. And you're probably getting the coronavirus here.
I know that there's a new lockdown for like I'm still
Good afternoon. The Subcommittee on Workforce Protections will come to order. Welcome, everyone. I note that a quorum is present. I note for the subcommittee that Ms. Susan Davis of California, Ms. Suzanne Bonamici of Oregon, and Dr. Kim Schreier of Washington are permitted to participate in today's hearing with the understanding that their questions will come only after all members of the Workforce Protection Subcommittee on both sides of the aisle who are present have had an opportunity to question the witnesses. The subcommittee is meeting today in a legislative hearing to hear testimony on the Healthy Families Act, H.R. 1784, examining a plan to provide paid sick leave to U.S. workers. Pursuant to Committee Rule 7C, opening statements are limited to the chair and the ranking member. This allows us to hear from our witnesses sooner, provides all members with adequate time to ask questions. I recognize myself now for the purpose of making an opening statement. Today we will discuss H.R. 1784, the Healthy Families Act, a proposal to establish paid sick leave as an essential workplace protection for our nation's workers. This hearing could not come at a more appropriate time. As we speak, the rapid spread of the coronavirus is highlighting the severe consequences of our failure to secure paid sick leave for millions of workers and their families. Across the country, public health officials are rightfully asking or requiring potentially infected Americans to stay home from work and avoid travel. But for many workers, particularly low-wage workers, taking time off when they are sick means losing the wages they need to cover basic expenses, including food and housing. Many have no choice but to work, even though they are ill. We're deeply concerned about the potential impact of the coronavirus epidemic, and we're continuing to explore different options for providing workers access to paid sick leave or on an emergency basis. Our nation's workers are particularly vulnerable to this emerging public health crisis because the United States is the only industrialized nation that does not require access to paid sick leave. For the more than 32 million American workers who cannot earn paid sick days, getting sick, whether it's a rare infectious disease or the common cold, often means having to choose between prioritizing their health and sacrificing their paycheck. Unfortunately, access to paid sick days is particularly limited for the low-income workers who need it most. Of the bottom 10% of private sector wage earners, just 3 in 10 have access to paid sick days. Making matters worse, inadequate access to paid sick leave is particularly concentrated in service industry occupations that have frequent contact with the public. A 2016 survey found that 86% of women in the fast food industry lacked access to paid sick days. For many workers, taking even a couple of unpaid days from work to recover from an illness could cost them a month's worth of utilities. As a result, workers often report to work even when they're ill, risking their health and the health of their coworkers. In 2009, researchers estimated that 20 million workers went to work sick. When so many people are unable to forego a paycheck and stay home when they're sick, an increased risk of infectious disease is inevitable. As a nation, we should have already learned this lesson. During the 2009 H1N1 flu epidemic, which killed more than 10,000 Americans, about one-third of infected workers went to work despite showing symptoms. This caused the disease to spread to as many as 7 million additional people. Even without a global health crisis, paid sick days are critical for public health. A recent 2020 working paper found that 1 year after enacting state laws allowing all workers to earn paid sick leave, those states saw an 11% reduction in influenza infections. Paid sick days also mean more productive employees and more profitable businesses. Our economy currently loses an estimated $234 billion each year due to reduced productivity from illness. Businesses are understandably hesitant to take on the additional expense of paid sick leave benefits. But even accounting for the cost of paid sick leave, studies show that businesses still come out ahead because higher productivity and lower turnover. In Austin, Texas, for example, an analysis showed that a citywide paid sick days requirement would provide city businesses a net savings of more than $4 billion annually. The evidence is clear. Access to paid sick days is critical for the health of our families, our communities, and our economy. Accordingly, 12 states, including Washington, D.C., and 22 localities, have enacted laws that require employers to provide workers with paid sick days. But it is ultimately up to Congress to establish a national floor for the right to earn paid sick days. The Healthy Families Act will help achieve that goal through three key provisions. First, the bill guarantees employees and in workplaces with 15 or more employees the right to earn 1 hour of paid sick or safe leave for every 30 hours worked up to 56 hours or 7 days. In addition, the bill covers public sector employees without regard to size of the employing entity. Second, the bill permits employees to take leave for themselves or a family member for physical or mental illness, injury, preventative care, and for survivors of sexual assault, stalking, or domestic violence. Finally, the bill prohibits employers from firing or discriminating against employees for taking sick leave. Today's discussion is long overdue. It's simply inexcusable that millions of workers in the world's wealthiest nation have no way to earn the paid sick days they need to care for themselves and their families. The committee also recognizes that we need to provide workers immediate relief in response to the coronavirus epidemic. And as we speak, the committee is considering a range of options for a federal response that protects the health and economy and economic security of workers and their families. And before I yield to the ranking member, I'd like to submit a statement into the record from a champion for paid sick days and the lead sponsor of the Healthy Families Act, Representative Rosa DeLauro. I would also like to submit a statement into the record from the National Partnership for Women and Families, a leader in advocating for paid sick days. Without objection. I now recognize the distinguished ranking member for the purpose of making an opening statement.
Thank you, Madam Chairwoman. The global spread of COVID-19, known more commonly as the novel coronavirus or just the coronavirus, has sparked conversations in recent weeks about health and safety in the workplace and paid sick leave policies. Committee Republicans have long supported legislative solutions that allow businesses of all sizes to develop innovative, personalized, and workable paid leave policies. Allowing business owners the flexibility to develop and offer tailored solutions that work best for their businesses and their employees can help ensure a positive and productive work environment and help small businesses remain competitive in a tight labor market. Take the Republican-led Tax Cuts and Jobs Act signed into law by President Trump, for example. This legislation included a tax credit for employers who voluntarily offer at least 2 weeks of paid family and medical leave to their employees. Another Republican-led initiative, H.R. 5656, the Working Families Flexibility Act, would allow private sector employers to offer their employees the choice of paid or comp time in lieu of cash wages for working overtime, a benefit currently available to public sector workers. And the employee can decide when to use this comp time, just as public sector employees can do. Just yesterday, President Trump made clear that he is interested in negotiations with Congress regarding additional paid sick leave proposals to help us get through the COVID-19 outbreak. And I was told just as I was coming in here that those discussions have indeed begun. If you want to solve a problem like this, you do it on a bipartisan basis, not a partisan basis. This bill, the one that we're here to talk about, is not the answer. It is a partisan bill. I hope my colleagues on the other side are not using the coronavirus as an opportunity to prioritize partisan interest in H.R. 1784. Even if it passed the House, this bill has no chance of passage in the other body or becoming law. It is a distraction to the serious bipartisan work Congress needs to be doing with respect to the coronavirus. The costly federal mandate contained in H.R. 1784 would do more harm than good and will have unintended consequences. As Ms. Melito notes in her testimony, A National Federation of Independent Business study of the economic impact of this bill showed that it would result in 430,000 jobs lost over a 10-year period and a loss of $652 billion, billion with a B, in cumulative real economic output. More troubling, small firms would account for 58% of all jobs lost, and small firms would bear 50% of the lost output. Unfortunately, this sentiment seems to be lost in the supporters of this bill, who seem determined to create additional hardships for small businesses by imposing a one-size-fits-all government mandate. Employers are attentive and responsive to current and prospective employees' workplace concerns and preferences for flexible leave policies. Instead of considering H.R. 1784, Congress should empower our nation's business owners to develop and offer flexible and personalized solutions. In fact, the vast majority of employers are already responding to their employees' needs. According to the Bureau of Labor Statistics, 73% of all private industry workers and 83% of all full-time workers have access to paid sick leave. Small businesses are pulling their weight as well. According to NFIB, 73% of small employers offer paid time off to the majority of their full-time employees. The bottom line is paid sick leave benefits are important, but a one-size-fits-all federal mandate is not the answer. In times of economic growth, as well as in times of crisis, job creators do not need additional Washington knows best federal mandates weighing them down that will ultimately harm job creation. In the near term, Congress should be working with the Trump administration regarding policies that help employees rather than considering legislation which micromanages every employer's ability to operate their business. I look forward to hearing from our witnesses today about how the federal government can continue encouraging the private sector to develop solutions that meet the needs of workers and their families. With that, I yield back.
Thank you very much. Without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on March 24, 2020. I'd now like to introduce our witnesses. Dr. Sarah Jane Glenn is a senior fellow at the Center for American Progress. She's a nationally recognized expert on family economic security with an emphasis on work-family supportive policies such as paid sick days and paid family and medical leave. Ms. Renee J. Johnson is the Senior Government Affairs Manager to Main Street Alliance, a 501c3 advocacy organization with a national network of more than 30,000 small business owners throughout the United States. Ms. Elizabeth Melito serves as Senior Executive Counsel with the National Federation of Independent Businesses, a position she has held since March 2004. Ms. Melito is responsible for managing litigation and amicus work for NFIB. Ms. Tanya L. Goldman is a senior analyst and attorney with the Job Quality Team at the Center for Law and Social Policy, CLASP. Prior to joining CLASP, Ms. Goldman worked at the U.S. Department of Labor and Equal Employment Opportunity Commission, EEOC. Thank you all for being here. We appreciate all the witnesses for being here today. Look forward to your testimony. But let me remind you that we have read your written statements, and they will appear in full in the hearing record. Pursuant to Committee Rule 7D and committee practice, each of you is asked to limit your oral presentation to a 5-minute summary of your written statement. And let me also remind the witnesses that pursuant to Title 18 of the U.S. Code, Section 1001, it's illegal to knowingly and willfully falsify any statement, representation, written document, or material fact presented to Congress, or otherwise conceal or cover up a material fact. So before you begin your testimony, please remember to press the button on the microphone in front of you so that it will turn on and the members can hear you. And as you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow to signal that you have 1 minute remaining. And when the light turns red, your 5 minutes have expired, and we ask that you please wrap up your statement. We'll let the entire panel make their presentations before we move to member questions. When answering a question, please remember to once again turn your microphone on. I will first recognize Dr. Green.
Chairwoman Adams, Ranking Member Byrne, and members of the committee, thank you very much for having the opportunity to speak to you today about the importance of paid sick days. My name is Sarah Jane Glenn, and I'm a senior fellow with the Center for American Progress and an expert on workplace policies, including paid sick days. Paid sick days are intended to address short-term illnesses like colds or the flu, or to care for a family member who's experiencing a similar short-term illness. They can also be used to access routine or preventative medical care. And there's also often the inclusion of safe days that can be used to address the aftermath of sexual or domestic violence. Paid family and medical leave is a separate policy that's intended to address more serious long-term issues like cancer or recovering from surgery. So these are two related but separate policies. They're not substitutes for one another. And so today I want to make sure that we're focusing on the shorter-term leaves covered under paid sick. Currently, the United States is one of only a handful of countries across the globe that does not guarantee workers the right to any form of paid sick leave. And we are the only industrialized nation that does not guarantee the right to any form of paid time off for any reason at all. As of March 2019, 27% of private industry workers, which translates to 32.5 million individuals, do not have access to a single paid sick day. 11 states, the District of Columbia, and 22 localities have passed paid sick days laws on their books that have made a tremendous difference, but they've also resulted in really significant geographic disparities. In the Pacific states, for example, 91% of private industry workers have access to paid sick days. But in the East-South Central region, which is where I live, only 62% of workers have access. And we know that low-wage workers are among those who are the least likely to have paid sick days. 70% of workers who earn less than $10.49 per hour have access to a single paid sick day. Rural workers, workers of color, and Latinx workers in particular are all less likely to have access to paid sick leave. Women are disproportionately impacted by a lack of paid sick time, in part because they are the parents who are most likely to have to take time off to care for a sick child. In one survey of working parents, a third reported that they feared losing pay or losing their job if they needed to stay home to take care of their child. And their fears are not wrong. Access to paid sick days decreases the likelihood of job separation by up to 25%, and those impacts are even stronger for working mothers. Understandably, we're all very focused on public health in this moment, but we also know that workers in public-facing roles are at an increased risk of contagion through these interactions with the public, and they can pose an infection risk to the clients and customers that they serve. But service workers have one of the worst rates of access to paid sick leave. 42%, or 11.7 million individuals working in the private sector, lack access to paid sick time. Food service workers are especially unlikely to have access to paid sick days, and as a result, we know that they're very likely to go to work when they're sick. And it's easy to try to blame individuals for this, but given the extremely low wages across their industry, they can be placed in an impossible situation. Most report that when they go to work sick, it's because they either can't afford to lose pay or because they fear being fired or penalized as a result of calling out. And this is a particularly salient issue in this moment, given the current global spread of COVID-19. Research has consistently shown across space and time that access to paid sick days increases the ability of workers to stay home when they're ill. So it's not difficult to understand why a policy like this has enormous potential to mitigate the effects of the coronavirus. The current patchwork of state and local policies that's in place right now is not sufficient to protect workers, and it's vital that Congress works to create a federal floor on paid sick days. I understand why folks are very focused on this current pandemic, but we also need to be forward-thinking. People will continue to get sick even after we have moved past this moment in time. So establishing a federal standard on paid sick days is going to be incredibly important, both in this moment and in the future, to help ensure that all workers are able to access medical care, to prevent the spread of contagion, and to make sure that they can care for their loved ones, regardless of where they work, regardless of whom they work for, and to ensure that we can protect the health of our families, individuals, and our communities. Thank you, and I look forward to answering your questions.
Thank you very much, Ms. Johnson. You're recognized for 5 minutes, ma'am.
Thank you so much. Chairwoman Adams, Ranking Member Byrne, and members of the Education and Labor Subcommittee on Workforce Protections. Thank you for this opportunity to testify today regarding H.R. 1784, the Healthy Families Act. My name is Renee Johnson, and I'm the Senior Government Affairs Manager at Main Street Alliance, a national network of over 30,000 small business owners who advocate for public policy issues that impact their businesses, employees, and communities. Our members across the country support a standard baseline of paid sick days that covers all workers. The need for this policy is more urgent than ever. At the national level, we support the Healthy Families Act, which guarantees 7 paid sick days. At the state level, our members have played an essential role in winning many of these laws in 11 states, the District of Columbia, and 22 localities across the country. Increasing access to paid sick days strengthens small businesses and boosts economic productivity. When employees go to work sick, they fail to perform to their full potential and also risk infecting coworkers. The loss in productivity to the U.S. economy due to illness in the workforce has been estimated at $234 billion, with a major portion of this coming from workers going to their jobs sick. Productive workers make for stronger businesses. As Main Street Alliance member Janet Jones of Source Booksellers in Detroit stated, when employees are healthy, they are happier, make good recommendations, and take better care of customers. Policies such as earned paid sick time are a win-win situation for the businesses, the employees, and the community. A baseline standard for paid sick days also boosts small businesses' bottom lines by helping to increase employee retention and reduce costs associated with turnover, which can cost thousands of dollars per position. Workers who earn paid sick time are less likely to leave their employer. Retaining well-trained and valued employees helps businesses of all sizes, but can be especially important for small businesses where the loss of a single employee can have a significant impact on operational and labor costs. The value of offering paid sick days to employees can be seen by our member Tony Samkamp of Samkamp Woodworks in New Jersey. He stated that since I started providing paid sick days at my businesses, employees have been happier and more productive. Far from abusing it, my employees saved their paid sick days for when they really needed it. Since introducing the policy, we have not lost a single employee. In fact, we've added 2. Providing all workers access to paid sick days will also help lower system-wide healthcare costs, saving taxpayer dollars for individuals and businesses. Ensuring access to paid sick time for workers who currently do not have any could prevent over 1 million emergency room visits a year, saving $1 billion in annual healthcare costs. Improving the health of our communities while lowering healthcare costs is important to small business owner. As Main Street Alliance member Peter Ferrargi of Gaia Flowers in Las Vegas, Nevada put it, my business is only as healthy as our community, and giving people a chance to stay home and recover from an illness is crucial for public health. When people work sick, it stresses our healthcare system, hurting all of us, including small businesses that face higher and higher healthcare costs. It's for these reasons that we see small business owners support paid sick days. A national survey of small business owners found that 64% supported a paid sick days minimum standard like the Healthy Families Act. Where paid sick days has been adopted, support from small businesses continues to be strong. In 2007, San Francisco became the first city to adopt a paid sick time policy. 3 years after passage of the law, 2/3 of employers supported it. Even business groups who did not initially support the policy came to see the benefits of the law. The director of Golden Gate Restaurant Association said, paid sick days is the best policy for least cost. Fear that paid sick days policy would have a negative impact on job growth, business formation, and relocation have not occurred. In Connecticut, business formation increased following the adoption of paid sick days. And in Seattle, 1 year after the policy's adoption, the city showed stronger growth in business formation. Implementation of new laws is also relatively smooth. An evaluation of Seattle's paid sick time law found that over 2/3 of employers did not have difficulty implementing the law, and those that did cite challenges found them to be temporary. On behalf of our small business members, I strongly encourage the committee to help ensure a stronger, more equitable economy by securing paid sick days for all workers. As the impact of expanding coronavirus unfolds, a stronger safety net, including paid sick days, is more urgent than ever. I want to thank the chairwoman and ranking member for hosting this hearing and look forward to answering any questions.
Thank you very much. Ms. Melito, you are recognized 5 minutes, ma'am.
Thank you.
To Chairwoman Adams and Ranking Member Byrne for inviting me to speak today. I also want to thank the additional committee members who are in attendance and the staff, too, who is here today. My name is Elizabeth Melito, and I'm an attorney in the National Federation of Independent Businesses Small Business Legal Center. NFIB is a member-driven organization that represents about 300,000 small and independent businesses across the country. Consider the varied types of businesses you frequent: pizza parlor, auto shop, dry cleaner, hair salon. Some have employees that are strictly full-time, others strictly part-time or hourly. Some have both. These are the typical NFIB members who employ around 5 to 15 employees. Only about 12% have a human resources professional, and the business owner or spouse is often the HR point person. Over 50% still do payroll in-house. I describe our membership to illustrate one of the key points of my testimony. There is no thing as a one-size-fits-all policy that works for every business or every industry. Employer mandates come with a cost, and not all businesses can afford that cost. We appreciate the reasons the bill has been proposed, but NFIB has long opposed inflexible or mandated leave requirements for a variety of reasons. And today I just want to touch on 3 concerns that we have with the Healthy Families Act. First, small businesses are an employer of choice in our communities because of the flexibility they offer their employees. In fact, most small businesses already provide their employees with paid time off. They provide flexible, mutually beneficial arrangements that allow employees time off when necessary in a fiscally responsible way. The bill's one-size-fits-all mandate would handicap businesses' ability to attract workers at a very critical time. Finding qualified workers is NFIB members' #1 cited problem, and one of the ways that small businesses compete with larger companies is to provide flexible leave policies. Small employers aren't as regimented in their leave policies as larger firms. So while the vast majority of small businesses offer paid time leave, most do not divide it up between vacation days, sick days, and family leave. The Healthy Families Act would add unnecessary costs and hurdles to the process that small business owners have developed for their businesses. It'll require more record keeping and place restrictions on time off that don't currently exist. If you can only afford to give your workers 10 days of paid time off and the government mandates 5 days of paid sick leave, then your employees only have 5 days of vacation leave. A second concern relates to the unintended and hidden costs the bill would impose. Mandated leave is not a free benefit for employees. In a small business with a finite amount of resources, this means less money is available for wage increases and hiring additional employees. As I mentioned, small business owners typically have few administrative staff and little human resources experience. This act would impose substantial record-keeping requirements, including new leave tracking, notification, documentation, and reporting requirements. Finally, the bill, my third concern, relates to what I call death by 1,000 mandates. Another federal mandated leave program will further complicate the patchwork quilt of ever-changing labor laws. When Oregon considered its paid leave proposal a few years ago, the legislative record was replete with opposition from small business owners. And I just want to quote from a submission from one small business owner. Quote, "We compete in a world market, and everything the state or the federal government does burdens us with more and more unfunded mandates that make us less competitive in world markets. So now I have fewer employees, and since there is not enough income after all my employment costs are met, I end up not getting paid anything for my family for all the work that I do. I could go on, but the bottom line is that we farmers don't make enough to subsidize all the wonderful benefits that you would like to see employees entitled to. I have workers asking for work, and there is plenty for them to do, but at the high cost that Oregon requires me to pay, I have to limit the number that I can hire. It may seem great to mandate more benefits to employees, but the hidden costs are fewer jobs. During times of emergencies like now, flexibility is even more important than ever before. NFIB is monitoring the current situation and working to support our members. We have been providing them with the CDC's guidance to prevent workplace exposure, and it includes the recommendation that employers, quote, maintain flexible policies to allow employees to stay home and care for themselves or a sick family member. Employers must be prepared for emergencies, but they can't be saddled with more mandates or costs. On behalf of the small business owners of NFIB, thank you for focusing on this important issue and for allowing NFIB to be represented here today.
Thank you very much. Ms. Goldman, you are recognized for 5 minutes, ma'am.
Thank you, Chairwoman Adams, Ranking Member Byrne, and members of the committee. My name is Tanya Goldman. I'm a senior policy attorney at the Center for Law and Social Policy, or CLASP, an anti-poverty organization that promotes effective federal and state policies for low-income people. I'm truly honored to be here at this moment to speak to the central importance of paid sick days, especially as a critical need for low-income workers and their families to stay employed without jeopardizing their health or economic security. I testify based on my experience on paid sick and safe days at the federal, state, and local levels. Previously, I was Deputy Chief of Staff for the U.S. Department of Labor's Wage and Hour Division when the department issued the final rule implementing President Obama's executive order establishing paid sick leave for federal contractors. And since 2016 at CLASP, we have been convening and providing technical assistance to state and local labor enforcement agencies, advocates, and worker organizations to share successes, lessons, and innovations in implementing and enforcing paid sick days policies. This convening has grown because of tremendous momentum in the enactment of local and state paid sick days laws. There are now 12 states, including DC, and 22 cities with paid sick days laws. I want to highlight 3 key points. First, the coronavirus underscores the urgent need for a national paid sick days law. Over 32 million workers do not have any paid sick days. When these workers need to get a flu shot, recover, care for their sick child, or take time because of domestic violence, sexual assault, or stalking, they face impossible trade-offs between their own and their family's health versus its economic stability. And during this public health pandemic, they can't stay home if they're sick. Low-wage and part-time workers, who often work in public-facing professions like food service and childcare, are least likely to have access to this basic right. For these workers, taking unpaid sick time can lead to foregone wages and even a lost job. Our failure to enact a national law has devastating consequences for individuals and families on a daily basis, and is contributing to a national public health crisis. Second, there's an overwhelming support for a paid sick days law. In a national poll, people across party lines agreed that paid sick days should be a basic workers' right. 86% favor a law providing 7 paid sick days annually for full-time employees. We see that support reflected in states and localities. Third, with over a decade of experience in implementing these laws, paid sick days are a no-brainer. Paid sick days help decrease the spread of illness, like the flu. They allow working people to care for themselves and for their family's health, and businesses are able to implement them. As detailed in my written testimony, studies show existing sick days laws don't harm jobs or growth. To the contrary, the Institute for Women's Policy Research estimates employers actually save money in addition to large public health savings. We know that there are critical elements to successful paid sick days laws. These include targeted education and outreach strategies that ensure employers are aware of their responsibilities and all employees know their rights, partnerships between community-based groups and government agencies, and measures to address workers' legitimate fears of retaliation should they exercise their rights. We see many of these elements in the Healthy Families Act. Most of all, the state and local progress also demonstrates that paid sick days are practical, successful, and broadly supported. A law like the Healthy Families Act will significantly improve working people's lives. Moms Rising member McKindry Rogers, a mother of 2 who lives in Washington State, is a testament to this. McKindry, like many employees who lack paid sick days, worked in the restaurant industry. Raising young children without paid sick days was understandably a constant source of stress. Missing just 1 day of pay threatened her ability to make ends meet. But Washington State passed a paid sick days law in 2016. McKindry now works in early childhood education and finally has access to this critical right. Just last week, she was able to take time off work to go to the doctor. She says it's incredibly important to her to take care of her health and her children's health, as well as stay home when she or her children are sick without risking her paycheck. In conclusion, providing adequate paid sick days to all workers, including low-wage and part-time workers and people of color, demands national action. While state and local paid sick days laws have been enormously important in increasing access and modeling successful approaches, a jurisdiction-by-jurisdiction strategy leaves out far too many people, and leaving it to businesses alone is not the solution. We cannot achieve the health, economic, and poverty reduction benefits without a national standard that sets a critical floor for all, regardless of where they live or for whom they work. Thank you for the chance to testify, and I look forward to your questions.
Thank you very much. Under Committee Rule 8A, we will now question witnesses under the 5-minute rule. I now recognize myself for 5 minutes. 7 cases of the coronavirus have been diagnosed in my home state of North Carolina, and more are expected. We know that communities across the country are bracing for impacts to public health and local economies, and workers across the country are struggling with the prospect of working while sick or the financial difficulty of no pay during a required self-quarantine. Ms. Goldman, how is the lack of a national standard on paid sick days putting our communities at risk?
The U.S. is one of the only industrialized nations without universal access to paid sick leave. As I noted, 32 million workers and 70% of low-wage workers, those in the bottom decile of wage earners, lack access to paid sick days, and they are particularly likely to work in public-facing professions. This means that if they are sick and can't afford to stay home, they are more likely to impact their own health and that of their coworkers, the public, as well as their children's classmates and caregivers and teachers if they send their children to school sick.
Thank you. Dr. Glenn, if the Healthy Families Act had been enacted into law years ago, would workers be less vulnerable to the current public health crisis around coronavirus?
Yes, I mean, I think it is important to note that there would still be public health concerns. Access to paid sick days is not the only tool that we need to address these types of pandemics, but we know from research that's been done under previous public health emergencies that paid sick days are one very important piece of the puzzle. There's an estimated 1,500 people who died with the H1N1 epidemic as a result of contagions that were caused by a lack of paid sick days. And the CDC has noted during previous health outbreaks that paid sick days are one important piece of making sure that people are able to self-quarantine. So without that policy, we would expect to see far greater spread of the disease.
Thank you. Ms. Coleman, could you add to that?
Sure, we know from state and local evidence that paid sick days help prevent illness and prevent the spread of illness. Workers who don't have paid sick days are less likely to get preventive and routine medical care, like their flu shots. They're also more likely to go to work sick.
Okay, Ms. Goldman, what are the unique concerns for access to paid sick days in a public health crisis such as the current outbreak that we have now? What can Congress do to ensure that working people can afford to heed the recommendation of public health officials such as self-quarantine?
The coronavirus is really exposing the reality that low-wage workers face every day. How can I stay home if I'm sick or need to care for a family member if I can't afford to lose those wages? When the CDC and public health experts are recommending that people who are exposed to the coronavirus stay home for 14 days, low-wage workers cannot afford to do that.
Okay. Ms. Johnson, how would ensuring that workers have sustained income through access to paid sick days now during the public health emergency promote the longevity for small businesses?
We see earned sick leave as an essential policy that ensures that workers can take time away from work if they are ill or need to take care of a sick family member without fear of loss of income. And passing a national paid sick days policy would go a long way in helping employers and employees cope with the virus and prevent its spread. Paid leave policies would work best in a functioning economy with time to ramp up earned sick day benefits. And we are seeing many advocates and elected officials begin to consider emergency paid sick day policies to handle this crisis. To make these laws work and rapidly increase the availability of paid sick days, impacted small businesses will need immediate cash flow for their support as well.
Okay, Ms. Goldman and Dr. Glenn, why is it important that Congress take action to respond to both our present emergency and guarantee workers paid sick days under the Healthy Families Act? Dr. Glenn?
So I think it is important to note that these are two overlapping but separate issues. So certainly what's happening right now requires an immediate response. Paid leave that is accrued over time, like the paid leave that would be available through the Healthy Families Act, is not necessarily appropriate when you're talking about an immediate emergency like we're facing with COVID-19. But I also think it's important for us to keep in mind that this is one moment that we're dealing with right now. People will continue to be sick. There will be future pandemics. pandemics, and people will need to access routine and preventative care in the future. So taking a multi-pronged approach is absolutely appropriate in this moment.
Okay, I've got 1 second, but I'm out of time now, so I'm going to now recognize the ranking member for the purpose of questioning the witnesses.
Thank you, Madam Chairman. Ms. Polito, businesses of all sizes are being affected by COVID-19. Why is it important that businesses have flexibility when they're dealing with issues like sick leave for their employees?
Thank you. So the small business owners who I've been in contact with, and we are doing a major outreach, we're doing a webinar for our members, we're pushing out, as I said in my statement, the CDC information. They are honest and fair employees. They want to do right by their employees all the time, but particularly now. And it's clear that this presents an extreme business challenge. My members are focused right now on keeping, first and foremost, their employees healthy, their customers healthy, and their communities healthy too. And, you know, as much as possible, keeping their businesses running during this time. This is a really challenging time until this coronavirus runs its course. But we caution Congress against rushing to impose any new mandates that will do more harm than good in the long term. Paid leave programs were not designed for the entire workforce to be out at once. And this bill is certainly not the solution for the current problem. Again, the CDC is urging employers to offer flexible policies, and that goes with what our members tell us all the time. They need flexibility, more so now than ever before.
So looking at H.R. 1784, do you think it would restrict the flexibility the businesses need to deal with this issue?
Yeah, absolutely it would. I mean, Dr. Glenn talked about, you know, different policies, and again, that's going back to kind of a siloed leave approach, and we're seeing that our members have moved away from that. The paid time off policy is what works for their businesses. Less record keeping, not, you know, tracking every day off and requiring doctor's notes and requiring notices and requiring an updated employee handbook. That's not what they need right now. They want sick employees to stay home. That's what I'm hearing from our members.
Your testimony highlights how small employers use benefits such as paid sick leave to compete for workers. How would H.R. 1784's restrictive mandate inhibit a small employer's ability to attract and retain workers?
Well, it may not be the intention of the bill, but the Healthy Families Act would disrupt current employer paid leave offerings. And as I've said time and time again, the majority of small businesses, the majority of employers do offer paid leave, and this would really upset what they have right now. For example, if an employer's existing paid leave policy fails to meet all of the requirements of the Act, the employer's plan would need to be amended to comply with the Healthy Families Act. In addition, it's unclear how the paid sick requirements in the bill would impact PTO plans. Would those still be permitted? Because again, they are not the siloed, different compartment things. And more employers each year are offering PTO plans in lieu of other employer paid leave programs. It would just really hinder the flexibility. Congress should build on progress that's being made by offering incentives to employers to do more, not risk the unintended consequence of this bill, which loads on more mandates, record keeping, and costs.
Ms. Milito, supporters of H.R. 1784 claim it excludes employers who are currently offering paid sick leave to their employees from the paid sick leave mandate, so that if an employer has a paid sick leave policy in place, this bill will have no impact on the business owner. Do you believe that to be the case?
Not at all. First of all, the Act does not supersede any of the state or local laws that provide for greater paid sick time or leave rights. So it's going to still force employers to comply with this patchwork quilt that's existing with the 22, municipalities that we've heard about from the other witnesses here today. I say in essence, it would require an employer to start from scratch, to take the onion apart. Here's what we have. Here's what our municipalities doing. Here's what our state's doing. Here's what our employers tell us. Our employees tell us they want. So peeling the onion apart and then putting the layers back together, it really stinks.
Yeah, I agree with that. I remember back when Congress passed the Family Medical Leave Act, it was as if they had completely forgotten that they had previously passed the Americans with Disability Act. And when they passed that, they completely forgot that there are state workers' compensation laws out there. So the onions are all over the place. We have a specific crisis right now. It seems to me, and I think what I hear you is saying is, your members, the businesses in America, want to be a part of the solution. These are their employees, their customers. They can't operate if they can't get control on this. And by putting this mandate on them, we've actually taken a serious crisis and made it worse. And I don't think that's what Congress should be doing. With that, I yield back.
Thank you very much. The gentleman from California, Mr. Takano, is recognized for 5 minutes.
Thank you, Chairwoman Adams, for this very critical hearing on the need for a universal paid sick leave program. The United States is lagging behind the majority of industrialized nations that have some form of paid sick leave. As has been noted, about 32 million people lack access to paid sick days. In the wake of the spread of COVID-19, it is extremely important that people stay home to reduce the spread of the virus. Unfortunately, workers and their families cannot afford to stay home. There has been extensive reporting that low-wage workers and those with frequent contact with the public are more likely to go to work while sick because they are less likely to have access to any form of paid sick leave. Missing a few days of work without pay is the equivalent of a family losing their monthly budget for food and health care. In the absence of a federal law, several cities and states have enacted different laws requiring paid sick days. Ms. Goldman, my first question is for you. What impact have these laws at the state and local level had on overall public health in the local economies?
The impact, thank you, Congressman Takano. The impact has been very helpful. Where we have state and local laws that have passed, state and localities that have passed paid sick days, one study has shown significant reductions in flu-like infection rates. In a study of San Francisco, after their ordinance was passed, a quarter of employees reported that paid sick days improved their ability to care for their and their family's health, with particular benefits for Black, Latinx, and low-wage workers. In addition, the San Francisco study reflected that parents with paid sick days were less likely to send their sick children to school, improving those children's health as well as the health of their classmates and teachers.
Thank you for that answer. How has job growth and employment been impacted in the various cities and states that have instituted paid sick day laws?
The studies of economic impact have showed that the existing sick days laws benefit employers and employees and have not harmed jobs or growth. The Institute for Women's Policy Research estimates that employers will actually save money in addition to public health savings. For example, in Massachusetts, they expect the law there to save employers close to $50 million annually. After San Francisco's law was passed, their study of San Francisco showed that the percentage growth in civilian employment was strong and exceeded the average growth of surrounding counties. And I'll just note that Seattle and DC auditors have also done studies that showed that the laws did not discourage businesses from locating in those jurisdictions.
Thank you, Ms. Goldman. Today, the World Health Organization declared COVID-19 a global pandemic. Dr. Glynn, in your written testimony, you stated that, quote, research on the 2009 H1N1 pandemic estimated that an additional 5 million people contracted the virus due to a lack of workplace policies like paid sick days, end quote. What impact, Dr. Glynn, would a federal policy requiring paid sick days have on public health and the spread of infectious diseases like COVID-19?
So while it's obviously too early to have figures like we have looking in hindsight to the H1N1 epidemic, there is a tremendous amount of evidence that indicates this would be a really vital public policy intervention to help halt the spread of the disease. You know, the CDC is calling for people to practice self-quarantine, to practice social distancing, and that's very difficult to do when you still have to report to work. So by covering the millions of workers who currently do not have access to paid sick days, we can ensure that they're able to stay home when they need to recover themselves and to reduce the spread of contagion. Again, we don't have exact figures that we can put onto that right now, but we're talking about literally millions of people right now who are having to make that trade-off between paying their bills and being able to stay safe.
Well, thank you. As Congress continues to develop its response to COVID-19, why is it important to ensure that workers have access to sick days now and also have have access to paid sick days under the Healthy Families Act?
So I think an emergency response is important to ensure that people can start staying home immediately, if that's what their medical providers are recommending to them. So an earned sick time proposal like the Healthy Families Act is not going to help someone who needs to stay home tomorrow if it's not already in place. But like I said earlier, we need to be thinking towards the future as well. We can't always be trying to play catch up. And so by passing something like the Healthy Families Act today, we can help to stave off future epidemics and pandemics that may be coming.
Wow, thank you, Dr. Glenn. The Healthy Families Act is common sense policy. While paid sick days are especially critical to workers as we respond to COVID-19, it will be necessary for workers across this country to still have access to paid sick leave once the pandemic is over. Thank you, and I yield back the balance of my time, Madam Chair.
Thank you very much. I'll yield 5 minutes to the gentleman from Texas. Mr. Wright, you're recognized.
Thank you, Madam Chair. You know, to hear the other side, you would think that small businesses are ignoring the needs of the workers, and we know that's not true, because they know that without healthy workers, they don't have a business. But what's really entertaining to me is to hear over and over again people on the other side saying that the United States is lagging behind. The United States is lagging behind other countries. We're lagging behind the rest of the world, when just the opposite is true, because the rest of the world is lagging behind the United States. They're lagging behind the United States in economic growth and job growth. There's a reason for that. Do we really want to be like Europe? Do we want to really be like South America? Because every time we go down this road with more government mandates, it always sounds great. It always sounds wonderful. And there's always a downside. And quite often that downside is an economic downside of fewer jobs or a loss of jobs. Ms. Melito, if this were enacted, what types of business specifically would be hurt by it most?
In talking to our members and in surveying our members in jurisdictions where paid leave mandates have passed and been imposed, it's clearly restaurants, retail, those with turnover, seasonal, are hardest hit with this. And it's the administrative costs and the headaches that come with this. Ranking Member Byrne mentioned the Family Medical Leave Act. Laudable goal. Started as, I think, a 12-page document there. And then the next thing you know, we have 200-plus pages of regulations now on FMLA.
Right.
I talk to businesses all the time that look at 50 as kind of a mark they don't want to reach because of the headaches, the record keeping, the costs associated with the FMLA. So the administrative costs are real. I hear about them. We see them in our survey data.
So the regulation itself is preventing growth in those businesses because they don't want to encounter that administrative burden.
Exactly.
Thank you, and I yield back.
Thank you very much. The gentlelady from Pennsylvania, Ms. Wild, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Let me just start by saying that I have the utmost respect for small and independent business owners. I truly do believe that they are the backbone of our communities. And I always weigh decisions on things like this in terms of how it will affect those smaller businesses. But at the same time, I'm deeply concerned that we are the only highly developed country without a paid sick leave policy. I think there are significant public health considerations, and we're right in the middle of one now, as several people here have observed. And I just want to start with Ms. Melito with, your testimony, your written testimony talks about how a one-size-fits-all policy doesn't work, and that it's not fair to smaller businesses. But my concern is that if we don't have a one-size-fits-all employer's standard for paid sick leave in this country, how do we reassure the public in times like these? Let me just give you an example. If the public doesn't have confidence that the small business deli down the street has a paid sick leave policy, I would suggest to you that what's going to happen, especially in times like this where we're in a period of people having fear of going out in public and patronizing businesses, what you're going to have is that people are going to stay away from that small deli because they're going to think, well, I don't know if their employees are going to work sick or not. They might just stay away altogether. You identified the industries that would be hardest hit as restaurants and retail, among others. And I would suggest to you that those are exactly the businesses that people will not patronize because of fear of encountering sick workers who are there on the job. Whereas if we had some sort of national paid leave policy, people could be reassured that the people they're encountering in their local deli, in their restaurant, in their store are healthy because they wouldn't be at work otherwise. I want to just talk for a moment, and I know you place great reliance on honest and fair employers. I wrote a couple quotes down that who encourage we need to be encouraging employers, we need flexibility. You said that we need to offer incentives to employers to do more, but you know, that doesn't seem to always work. One of the examples I would give you is that in 2017, when the Tax Cuts and Jobs Act was passed, which gave corporations large tax cuts, as we know, with the idea being that those tax cuts would be put back into the workers' pockets. What happened instead is that we've ended up funding dividends to shareholders and increased executive pay, and we haven't seen that money going back into the workers' pockets. So I don't know that incentives to employers are enough. One of the things that I'd just like to address in your written testimony, you state that most small employers, and you say 73% of them, offer paid time off to the majority of their full-time employees, and 67% of them offer 2 weeks or more of leave. Well, first of all, I just want to, your only citation in your written testimony is to a poll conducted by your organization of of independent business owners. It's a self-reporting poll, correct? So it relies on the employer to give truthful answers, right?
It is an NFIB research foundation poll.
And NFIB is the organization that you work for, correct?
That is correct.
So those statistics, assuming that they're correct and that they were properly self-reported, don't account for any part-time employees, true?
No, that's not true. That's, I think you read that the majority of employees offered leave. I'm sorry, I missed your quote there, but I think it might, I think
The quote from your report was most small employers, 73% offer PTO to the majority of their full-time employees, okay? So can we agree that part-time workers are becoming more and more prevalent in our economy today?
I can't speak to the numbers of part-time versus full-time workers there,
But
but what I can tell you is that the majority of NFIB members and small businesses as a whole offer paid time off, and Ms. Johnson, I think, used about the same number.
Well, when you say the majority,
the
yeah, you say
73% to match there.
73% to full-time employees, but those statistics don't account for part-time employees. And we know from your own numbers that 27% of small employers, 27%, a quarter, more than a quarter, do not offer paid sick leave to the majority of their full-time employees, right?
What I can say is if a business can afford to offer paid leave, it is a great benefit. And my members tell me that. They'd like to offer paid leave. And those that do not, I said in my opening statement, mandates come with a cost, and not all small businesses can afford this mandate, the mandate of paid leave. And that's the fact of the matter. I mean, it's economics 101. I wish they all could, but they cannot.
Thank you. My time is up. I yield.
Gentleman from Virginia, Mr. Klein, you're recognized 5 minutes, sir.
Thank you, Madam Chair. Ms. Melito, I appreciate you recognizing in your testimony there's no one-size-fits-all policy that works for every business or industry. It's that very reason that we should be cautious as lawmakers of creating reactionary policies that result in stifling business. You hear about the businesses that would be happy or are happy to provide that leave. They have that option. You don't hear about the businesses that are unhappy when they are required to provide that leave because they are not in existence. They have closed up shop because they can't shoulder the burdens that come with being mandated to provide that leave. Many small businesses exist because the owners were tired of the bureaucracy they faced with rigid workplace policies. These entrepreneurs wanted to take matters into their own hands and create an opportunity in which they can allow employees to customize benefit packages that work for them. Lawmakers should not take that away from them. In my home state of Virginia, we have 1.5 million people who are employed by small businesses, with small businesses having an average size of 10 employees. In fact, 99.5% of Virginia businesses are small businesses. They have a significant impact on the economy with an average $500,000 in gross sales per year and are a large part of what makes local communities so vibrant. And I'm continuing to look for ways to empower businesses to give more choices to their employees. Unfortunately, what we've seen over the last General Assembly session in Virginia is a step backward from those policies that have made Virginia the best state in the country in which to do business, or to open a small business, or to run a small business. The #1 state, as ranked by CNBC, in the entire country. But the policies that we have adopted, make no mistake, this is a point of inflection in Virginia's rankings. And I worry that the policies that have been adopted over the past 2 months in Virginia are going to result in our rankings being driven down, businesses locating in Virginia less, fewer businesses opening in Virginia, and more businesses closing. I had frantic small business owners messaging me directly as these policies were being debated, assuring me that they would have to close if the bills passed. Now, not all of them did pass. We retained our right to work law, thankfully, but a number of others did, and we can't make those same mistakes at the federal level. Ms. Melito, does the inflexibility of H.R. 1784's prescriptive mandate limit a small employer's ability to offer other benefits that their employees may prefer, such as a pay increase or flexible paid time off banks?
It does. I mean, I think when we poll our members, they oppose mandates because of the assumption that every business of any type can afford to offer the same sort of benefits as larger companies, and that's just not so. And in the long run, as you're hearing from your friends who own businesses in Virginia, in the long run, if a company can't sustain a benefits plan, especially a mandated benefits plan, it's ultimately going to hurt the workers, because what's going to happen? The business is going to end up shutting its door. And that's what, unfortunately, we're seeing now in Seattle. It was in the Seattle Times yesterday. I mean, a list of restaurants that have now closed, and one of the business owners said, you know, it was already a difficult climate in Seattle to operate a small business. And that's what I fear will happen, especially in some of the municipalities that have already mandated leave benefits.
Paid sick leave is obviously not a free benefit for employees. Can you discuss how paid leave benefits in general figure into the cost of an employee's compensation?
In talking with members, you know, when they get hit with a mandate, decisions are made. You know, are we going to continue to offer, you know, our bucket of PTO? Does that comply? No, maybe not. If they're, you know, if they hit the threshold and they're offering paid leave, then, you know, real decisions are made. Are we going to cut bonuses? Are we going to hire fewer employees so we don't meet the threshold, if there is a threshold? Are we going to stop sponsoring the Little League? This is coming from a real business owner. If we're a restaurant, are we no longer going to offer staff meals? Things like that. Some of them are perks, but some of them are very real. The Christmas bonuses, cutting out overtime. Hard decisions that a business is going to have to make in order to determine, you know, how can we comply and pay for this mandate?
Thank you. Madam Chair, I yield back the balance of my time.
Thank you very much. I recognize the gentleman from Virginia, Chair of the Education and Labor Committee. Scott, you recognize 5 minutes.
Thank you. Ms. Gwynn, what would happen if we don't consider this as an emergency and figure out how to get everybody access to paid sick leave?
Well, I think there's a couple things that will happen if we continue to see high levels of workers without access to paid sick days. One is that we should anticipate seeing higher levels of contagion, because people will, out of economic necessity, continue to go to work when they are sick. That's likely to be especially true among the low-wage workforce and the service sector, and those are folks who are likely to be in direct contact with the public as part of their work. So we should absolutely anticipate more people will get sick as a result of a lack of paid sick days. The other thing that we should be thinking about in the context of a public health emergency are the macroeconomic effects. So right now we're seeing already a combination of reduced labor supply because people are out sick. Even if they don't have sick time, they may just have to stay home because they're simply too ill to leave, or because they're quarantining themselves in concurrence with the CDC recommendations. We're also seeing reduced demand for goods and services, particularly as people are practicing social distancing. So we're starting to see macroeconomic effects as a result of this. Having people forced to take unpaid sick time and seeing a dramatic drop in their income is only going to exacerbate those effects. So there's sort of two pieces that we should be thinking about here, and both are equally important. One is about the physical health of our communities and making sure that we are addressing the pandemic and addressing people's public health. But the other is thinking about the health of our local economies and making sure that folks have money to put in their pockets, because the fact that you have gotten COVID-19 does not mean that your bills stop needing to be paid. So we should be thinking about these two pieces in tandem as we address this current pandemic.
If we provide legislation for coronavirus specific problems, what elements should be in that kind of bill?
So I think it's incredibly important when we're thinking about public health in the context of a global pandemic to make sure that you're covering all workers. Any type of carve-out from a public health perspective simply does not make sense. You're also going to want to be thinking about the level of wage replacement. So paid sick days traditionally pay the same amount that you would earn if you were working. And I think that in contrast to something like unemployment insurance, which has a much lower level of wage replacement because they're incentivizing people to return to work as quickly as possible, you don't want to incentivize people to be returning to work too soon under these circumstances. So universal coverage is very important. A high level of wage replacement is incredibly important. And making sure that the benefit is easy to access for folks. You don't want it to be overly administratively burdensome, either for leave takers or for their employers. So trying to figure out the most efficient, cost-effective, and timely way to get these benefits out, I think is going to be some of the most important things to keep in mind.
What are some of the ways that the benefits can be done with less logistical problems?
I would need to spend a little bit more time thinking about that before I gave an on-the-record recommendation. I know things are moving very quickly, and I know there are a lot of people who are thinking about this, but we should be trying to figure out...
One of the things we're talking about are tax credits to businesses that are, for which we impose the mandate. Would that be something that could be quickly accessed?
I think it would just depend exactly on how that was structured. Certainly there do need to be supports, particularly for small businesses. It's right to note that this is different than a traditional paid sick days where you're talking about an extended length of leave and potentially your entire workforce being out at the same time. So having that economic support for businesses is going to be very important. My concern would be with a tax credit, when is that money actually going to hit your account? When are you going to see that? To what extent would that be refundable? I think there's a lot of detailed questions that would need to be answered to figure out if a tax credit for employers as reimbursement is the most efficient way to get that money back to them.
Can you think of any more efficient way?
I mean, I think direct transfers to the extent that that's possible, but again, I feel uncomfortable talking off the cuff right now. I'd need to spend a little bit more time, but I'm happy to follow up with you or anyone else from the committee to think through some of those details.
As quick as you can.
Yeah.
Thank you. Yield back.
Thank you. The gentlelady from North Carolina.
Madam Chair, can I ask unanimous consent to enter into the record a letter from Moms Rising dated today in support of family medical leave?
Without objection.
Thank you.
The gentlelady from North Carolina, Ranking Member of Education and Labor, Dr. Fox, you recognize.
Thank you, Madam Chairman. I want to thank the witnesses for being here today. Ms. Melito, H.R. 1784 allows employers with fewer than 15 employees to opt out of the paid sick leave mandate, but it still requires them to provide an equal amount of unpaid leave. Why is H.R. 1784's opt-out provision misleading, and how would it impact small employers? Would these employers also be subject to onerous compliance requirements?
Thank you, Dr. Fox. So while the bill does exempt businesses with fewer than 15 employees from offering paid leave. It would require all employers to offer unpaid leave, and it would require all businesses to make, keep, and preserve records pertaining to compliance with the Act, and to potentially make submissions on an annual basis. Moreover, employers of all sizes would be subject to the same enforcement, penalty, and liability provisions, which are pretty significant. And no Main Street enterprise, alone or collectively, can match the resources, I would argue, of the U.S. Department of Labor, whose charge is to conduct audits and assure compliance. So that is a real concern for small businesses, is DOL knocking at their door and asking for records related to this act when they don't have an HR person.
Well, you mentioned that earlier in your testimony, and as a former small business owner, I'm very well aware, and my daughter runs our business now. She does HR, she does everything because it is such a small business, and I am certainly well aware of what these kinds of things would do to her, especially a business that's seasonal. When you're in the nursery and landscaping business, it's seasonal, and you have to do everything you can to try to get the work in when the weather is good. It's a major challenge to be able to work only when the weather will allow you to do that. And you mentioned farmers earlier, and I can see that happening. Ms. Melito, as Congress considers additional steps to address COVID-19 in the workplace, supporters of H.R. 1784 and similar prescriptive employer mandates argue the federal government should force all employers to provide dictated benefits. Why should Congress think twice about imposing a one-size-fits-all mandate on small businesses, especially under current circumstances? And I even wonder why in the world we need to ask that question, because anybody with any common sense would know we shouldn't be doing that, but please give us your response.
Right. So February was another historically strong month for the small business economy. This was under our Small Business Economic Trends Survey, so we don't have any data from the current period right now. So it's worth noting again that the responses were collected prior to the escalation of the coronavirus outbreak. So business, was good, but the outbreak remains a big unknown, and we are collecting data. And until we know, we are actually going to be releasing a survey that we took over the last couple days tomorrow. And until we know how this is impacting our membership, we aren't in a position to talk about remedies or what will work or what our members need right now, because we just don't know. And it's so dependent on where they are, what industry they're in. Are they in travel? Are they in restaurants? Boy, we are hearing from those members. But in other industries, we just haven't heard from them yet. So again, it's not the time to make a rash decision. I think we all need to come together. This is kind of an all hands on deck, come together, and we are eager to see any bipartisan proposals that might be introduced to support small business and employees.
Well, you have spoken to the issue of fines, penalties, potential litigation, the many hats that a small business owner has to wear. Is there anything we haven't asked you related to penalties, fines, record keeping that should be additionally highlighted as it comes, not just to small businesses, but particularly small businesses, since you're from NFIB, but for other businesses too?
Yeah, the list of the legal and enforcement provisions contained in the Healthy Families Act is daunting, particularly if you're a small business owner. So for your daughter, it would be very daunting, who doesn't have the time or expertise to make heads or tails of a statute and presumably the regulation that would be forthcoming from DOL, which is going to be, long. Small business owners don't have time to read regulations, 50, 100-page, 200-page FMLA regulations. And it gives the Department of Labor, the Secretary, tremendous amount of enforcement authority there. So it is concerning from the perspective of a representative of the small business community. They need to be concerned.
Thank you very much, Madam Chairman.
Thank you. I'll recognize now the gentlelady from Georgia, Ms. McBath. You recognize 5 minutes.
Thank you so much, Madam Chair, and I seek unanimous consent to submit 2 letters into the record, one from Unidos US and the other from the YWCA, which outline why paid sick leave is necessary for our country.
Without objection.
Thank you. Thank you, Madam Chair, and thank you to all the witnesses that are here today. This is really a very, very timely hearing today, and I just want to say that, we understand that paid sick leave is just absolutely necessary for a thriving and modern economy. Creating a framework for paid sick leave is essential for building a fair and equitable society. It's important that we are gathered here today to find some effective solutions and a pathway forward. I just spent a few moments today, earlier, talking with members of the airline community, which I worked for 30 years, and then also small businesses. And I can assure you they're very, very concerned about making sure that people have access to paid sick leave. And we're seeing that the spread of COVID-19 virus, no one is immune to caring for themselves or a loved one during this medical crisis. When unprotected workers come down with an illness, it's vital that all of us are able to take the time that we need should we succumb to this virus. Under current law, over 30 million workers are not eligible for paid sick leave, forcing many of these individuals to choose between their health or their economic security. And no one should ever have to lose their job, forced to lose their job, or sacrifice their health simply because they or a loved one are sick. And this is a protection that we would all want if we were faced with being in this similar situation. We should all have a vested interest in supporting our workers and allowing them to take the time that they need to care for themselves or for one another. We know that paid sick leave can have a cascade of positive effects on our health and economic well-being for the nation. Dr. Glenn and Ms. Goldman, I'd like to ask you, how does the lack of paid sick days impact children's health? I want to talk about specifically how there is an impact on our children's health.
So we know that almost a third of parents lack access to paid sick days, which clearly has implications for their children's health. In focus groups, parents will actually report making the difficult decision to send children to childcare or school sick and give them Motrin and hope they make it through the day. But we know that with paid sick days, parents are much more likely, understandably, to stay home when their child is sick.
And I would also note on top of that, that we know that when people lack access to paid sick days, they're both more likely to forego medical care for themselves, but also for their family members. So children whose parents don't have access to paid sick days are less likely to see routine medical appointments like they're supposed to. We also know they're less likely to receive vaccinations, including flu vaccinations, when their parents can't take that paid time off to take them to the doctor.
Thank you for your answers, and protecting the health of our children should always be our top priority. When I came to Washington, I knew that I wanted to pursue policies that actually have positive effects for all of my constituents and for Americans at large. And I believe that paid sick leave is one of those policies that helps both employees and our employers. We also know that there's a significant cost associated with employees when they're working while sick. Some estimates show that national economy spends over $200 billion annually in lost productivity and has an outsized impact on our small businesses. Ms. Johnson, how would the Healthy Families Act support our small businesses?
The Healthy Families Act would support our small business in numerous ways. One, we would help our lower wage workers have some sort of floor or safe net, right? They'll be able to then take their children to the doctor when they need to. They'll be able to go to the doctor themselves when they need to. It would be able to help the small business be more productive, because when they're going to work and they're not feeling well, they're not going to be able to produce. So the productivity of the organization is going to fail because they're going to be more engaged in, I'm not feeling well. I'm not feeling well, and telling their coworkers and potentially passing on their illness to other coworkers. So ensuring that we have some sort of safety net where people are able to take care of themselves means that we'll have happier employees, and happier employees mean we're to have happier employment situations.
Thank you so much, and I yield back the balance of my time.
Thank you. We'll yield to Ms. Stevens, gentlelady from Michigan. You have 5 minutes.
Thank you, Madam Chair, and thank you to our witnesses. We're having this hearing on paid family sick leave under the pretense of a pandemic. And it was just reported that in Italy, they've seen a 30% increase since yesterday in fatalities. And this is most certainly a somber time, and a time that begets the conversation that we are having, and that each of you bring forward with your testimonies as we seek the best set of economic solutions, not only for the health of our own country, but for the future health of our country. And Ms. Johnson, I am incredibly struck by your organization and your work, in particular representing the businesses that you represent and the work that Main Street Alliance has done. I am deeply appreciative of the work of the National Partnership for Women and Families as well, that has always helped us here in Congress with these topics, and particularly with paid family leave. And I was wondering, given that I helped launch the Women in STEM Caucus, and there's been such a big conversation around diversity, inclusion, and minority ownership of businesses, if you wouldn't mind speaking about those perspectives as well, and how paid family leave help women of color. I've spent a lot of time in Michigan partnering with a group called Mothering Justice. They're another one of our advocates for this topic. And it's certainly so important to talk about women of color and how they're affected by lack of paid sick leave.
Yeah, definitely, and I will definitely open this up to my national partnership organizations that we work with.
Everyone is welcome to chime in.
Yes, because it's not just one organization, it's all of us, and diversity and inclusion means that we're all included in it. And our small business owners, we see that they definitely know that it is a burden sometimes for those who are low-income, low-wage workers to not have these benefits, right? Because they're not able to just take off when they need to and take care of themselves. Because again, like I mentioned earlier, healthier families, means healthier work environments as well. Especially with those communities of color, we see that there's a larger amount of those that have not receive those benefits. And so it stays in a system, in a cycle where if you're low wage and you aren't able to take off, you're more likely to quit your job, right? Then that employer then has to find a new employee, retention, training, and hiring that new employee, then it costs more money. So on both sides of the coin, having this supportive legislation would be great because it will help those lower wage, low income communities of color more efficiently.
Dr. Glenn, I know CAP has done a lot of great work on this as well.
Yeah, so I did a research project a few years back using a nationally representative data set, and one of the most striking findings that came out of that was that even when you controlled for a whole host of factors, age, gender, marital status, presence of children, health, the type of job someone had, their income, Latinx workers were statistically significantly less likely to have access to paid sick days. So compared to their colleagues that they were identical on all other factors with, the fact of being Latinx made you less likely to have access to paid sick leave. And so I think that points to why we do need to have interventions to help level the playing field, because clearly the market is not taking care of this issue on its own when you can see those kinds of disparities.
And also very similar to raising the minimum wage, which is a conversation that we are having at all times here in this Congress, and certainly legislation that we've passed, but you see a lot of those similarities as well. With the remaining time, did Dr. Goldman or Ms. Goldman, you want to chime in?
I just wanted to add also that I know right now we're talking about passing the law, but the implementation and enforcement is critical also. What they found in San Francisco after they passed their paid sick leave ordinance is that most employers were in compliance, but for those that were not, it was most affecting Black workers, low-wage workers, and Latinx workers. So part of it is the implementation and enforcement and ensuring the technical assistance so all businesses can comply with the law.
For equality. Well, thank you so much, and Madam Chairwoman, I yield back the remainder of my time.
Thank you very much. I'll now recognize the gentlelady from Oregon, Ms. Bonamici. You're recognized 5 minutes, ma'am.
Thank you very much, Chair Adams and Ranking Member Byrne, and thank you to all of our witnesses today. I represent Northwest Oregon, and I hear from restaurant workers and retail clerks, social service providers, childcare workers. They struggle to address their own medical needs or the medical needs of their family members, their children, without fear of losing their jobs and wages. And it is, of course, only exacerbated by the coronavirus epidemic, which we are facing. Very timely to have this hearing now. Healthcare workers like Destiny in Oregon, she works in a long-term care facility. She said, I would be hesitant to tell anyone I was feeling sick. I can't afford to miss paying my bills. And she added, people will continue to work while sick and risk exposing residents as well as other healthcare workers to the coronavirus. Fortunately, in Oregon, most workers have access to protected sick leave, and for the majority of workers, that sick time is paid. I want to note that I've heard from small businesses, but also small businesses in Oregon, that the sick leave law is good for their business and it's good for the economy. And Ms. Johnson, I know you mentioned Jim Hauser in your testimony. And my mother was a small business owner. My first job was in a small business. I understand the importance of small businesses, but truly across the country, far too many workers do not have access to paid sick days. So as we continue here in Congress to coordinate our response to the coronavirus and as communities continue to face more common short-term illnesses like the cold or the flu, we absolutely need to do all we can to make access to paid sick and safe days a priority. So I'm pleased to support the Healthy Families Act and the Paid Sick Days for Public Health Emergencies and Personal Family Care Act to help make sure that all workers have access to protected sick leave without losing wages or their job. And I have to say, as a mother and a policymaker, I know no parent should have to make that decision between losing their job and taking care of a child. Dr. Glynn and Ms. Goldman, what are the individual and public health consequences when workers do not have paid sick leave and they go to work when they or their family member is sick? What are the public health consequences, Dr. Glynn?
Yeah, I mean, I think the example that you just gave about someone who's working in a long-term care facility really highlights how important these policies are, because that's someone who's directly interacting with the most medically vulnerable folks, particularly given the context we're in right now, but always, right?
Always.
And I am not being hyperbolic when I say people have died because of a lack of paid sick days, right? I mean, some of this we can document. So like I mentioned before, the American Public Health Association has said that 1,500 deaths during the H1N1 epidemic can be traced back to people going to work when they were sick and contagious. But it goes beyond that as well, because we also know that people who lack access to paid sick days are much less likely to go to the doctor, and they're much less likely to access preventative care, so things like colonoscopies and mammograms, right? And so what we often see is this uptick in emergency room usage among people who lack access to paid sick days. Some of that is a scheduling conflict because the emergency room's open, but some of that is also because, and we have documentation of this, although it's hard to study at a large scale, that folks will let their medical condition go until it's too late or until it's much more serious than it might have been otherwise. Mm-hmm. So that has negative impacts on the individual's health and their family's health.
I want to hear real quickly from Ms. Goldman, too.
I agree with everything Dr. Glynn said, but I would just note, I mean, it starts very early in life, so women are less likely to delay the prenatal care they need if they don't have access to paid sick days. They're less likely to be able to take their new babies to the 8 recommended well baby visits, not to mention babies and toddlers get sick and to their appointments after that. So very early in life, we're seeing these multiplier effects of not having a paid sick days policy.
And in my remaining time, Ms. Johnson, we know that workers without access to paid sick leave are disproportionately low-wage workers and workers of color. Why should there be a federal standard for paid sick days, separate from like vacation time or flex time? Why should that federal standard be a floor rather than preempt stronger state laws?
Yeah, we believe that there should be a floor because if a state is already doing it, implement it, great, but just make sure that it's the floor. It'll be the standard so that there's a baseline that people can then look up to and say, all right, this state is doing this, and maybe that'll be competition for these small businesses to have more people coming to work for them. There's other opportunities for us to see growth here, right, when we have this baseline. And we want to make sure that our small business owners are able to be successful, and having this benefit makes them more competitive with larger businesses in their community as well.
Absolutely. Thank you so much. And time's about to expire. I yield back. Thank you, Madam Chair.
Thank you very much. I'll yield 5 minutes to the gentlelady from Minnesota, Ms. Omar.
Thank you, Chairwoman. I am so glad we're here discussing this topic today, and I very much appreciate the testimony of our witnesses and all that you have all shared. Though I have to admit, I have long been convinced by the case for universal access to paid sick leave, and feel like it's finally time that we stop debating the policy and just pass this life-changing law already. So instead of asking questions to our witnesses to elaborate on their testimony, instead, I would like to use this time to share some of the stories that have me so convinced that we need to implement a national sick leave program. Stories from Minnesotans like Donna. Donna works 2 part-time jobs, neither of which offer her a paid sick days. Like many Americans, Donna has ongoing healthcare struggles. Over the last 2 years alone, she's had to leave she had to have 3 different surgeries. And without access to sick days, Donna has had no choice but to miss work while she was in the hospital and in recovery. That means she's lost out on over 3 months of pay. Meanwhile, her medical bills are piling up. I would also like to tell the story of another constituent of mine, Catherine. As a working mother, Catherine finds herself choosing between the only 3 options she has when her kids get sick: lose a day's pay to stay home, send her children to school, no matter how sick they might be, or forcing one of her older children to stay at home from school to look after their siblings. If Catherine had paid sick days, she wouldn't have to choose between those 3 absurd options next time one of her kids is under the weather. No mother should be forced to sacrifice a paycheck to care for an ill child. I would also like to share one last story from Marian. Marian works full-time as a registered nurse in a Minnesota hospital while raising a young family of 4. Marian is only allowed 3 paid sick days per year. Working in an emergency room, she has had high exposure to illnesses, and given her role as a caretaker, it's critical that she's not only ill while looking after an already vulnerable patients. But how can she afford to do that with only paid sick days? Any parent in this room could attest to the fact that when you are raising a family of 4, 3 days is not going to cut it. So yes, although I'm glad we've had this hearing today, I hope we can make this the last conversation we have about this. We need to get this done for Donna, for Catherine, for Marian, and for countless others. I would also like to mention a topic many of my colleagues have brought up today, the response to the coronavirus concerns. Although I'm pleased that the House swiftly passed emergency appropriation last week to help fight the epidemic, I'm disappointed that Congress has not done more as a governing body for workers. If you walk up and down the halls of this building, you will see numerous signs on office doors indicating that some congressional offices have decided to close, are allowing their employees to telework, or have decided to not take meetings in the public. Although I respect the instinct to protect one's staff, we have to stop and ask ourselves, does the average American have this option? Or is this a privilege that only some, including the members of Congress and employees of this body, are lucky to have? We can't sequester ourselves while ignoring the countless Americans who work in consumer or food service or those in healthcare fields actually fighting this epidemic. Those workers don't have the option to telework, nor can they afford to go without pay. More than 30% of workers in Minnesota are employed by the healthcare, retail, or hospitality industry. That's nearly 1 million workers just in my state, and many of whom have no choice but to go to work regardless of the risk. We need to fix this problem long-term and make sure everyone has access to leave. I can't understand how anyone could continue to argue that paid sick is unnecessary or a luxury that this country can't afford. Frankly, we cannot afford not to act. I think it's time to consider this case closed. Thank you, and I yield back.
Thank you very much. I would now yield to the gentlelady from Washington, Dr. Schreier. You have 5 minutes.
Thank you, Madam Chair. First of all, thank you for all coming here to talk about this very important issue. I think it's important, in particular, it is important for women, and I'll get to that in a moment, but I have to first just touch on the issue of the coronavirus pandemic that we're facing right now, because this is so big, it almost doesn't even belong in this particular discussion where we are talking about 7 days of sick leave, that this poses tremendous threats to workers, to sick people, and also, Ms. Melito, to small businesses. And in fact, I looked up the article from the Seattle Times, and in fact, the business that you referred to that was talking about closing, it was because of slowing business from the coronavirus epidemic, not from paid sick leave. I just want to be very clear that this was related to what is going on right now, and I think we can expect to see that ripple effect across. That is not related to paid sick leave. It is related to people not going to businesses and people holding on to money because there isn't enough money because they're working or they can't work. I think that's our job in Congress, and would agree with my colleague, Ms. Omar, who just talked about our responsibility to workers, and I'm happy that this week we will be passing something to do just that, to make it so people can take off a month if needed to quarantine and to take care of family members if affected, and that we will help with unemployment as well. There's been a lot of talk about small businesses and a particular toll on small businesses with this. And so the first thing I just want to say is that I don't think that 7 days of paid sick leave is at all generous. I think that is a bare minimum. And frankly, I think that is the least we can do for our workers, whether we're a large corporation or a small business, that this really should be the floor. And before we get too wrapped up into talking about how this is hard for small businesses, I wanted to maybe highlight some of the ways this is really good for small businesses who only have a few employees, and if one comes to work sick and gets 2 others sick, what that would mean. So I wonder, Ms. Goldman, could you talk first about some of the benefits to a small business?
Sure. I mean, the lack of paid sick days laws encourages presenteeism, or going to work sick. If workers can't afford to stay home because then they don't have groceries and rent payment, they're going to come to work sick, and as you note, could potentially make their colleagues sick or make the public sick and spread it, which is going to, as I believe Ms. Johnson noted, have economic impacts on the business as well.
Thank you. And we've seen some of that in Washington State and King County. This is sort of the epicenter of the coronavirus epidemic right now, that workers in a nursing home came to work probably because they did not, I don't know about their situation, but feeling pressure to work because without work they don't get paid. And one of those workers also moonlights in another nursing care facility, and so we are now seeing it pop up in that one, which I think highlights the public health interest and also the personal interest in having those paid sick days. I also wanted to just answer, our ranking member talked about why in the world would there be a requirement for small businesses with fewer than 15 people to have mandatory unpaid sick days off. And I just wanted to clarify that the reason it's there is that people otherwise would get fired if they took sick days. And so I just want to be clear that there is a very good reason, even if they're not paid. Next, I wanted to talk a little bit about kind of the social implications, that who is most affected in a population by not having paid sick leave? Is it women? Is it low-income people, minorities? Highlight who that would be and whether they have children for me, please.
Sure. So we know it's the most vulnerable workers are the ones who are the least likely to have access to paid sick days. So that's folks who are earning low wages. That overlaps a lot with people who are working in the service sector. And we know if you look at who those workers are, they're disproportionately likely to be women and women of color, many of whom are raising families. I think it's also important to note that people without access to paid sick days are more likely to fall into poverty. They're more likely to experience food insecurity, and they're more likely to need to apply for and receive public benefits as a result of their economic instability and insecurity in their lives. So having paid sick days, I think we often talk about the cost of these policies, but there is also a cost to not having these policies. And I think we're seeing that very much in the public health sphere right now, but there are economic and interpersonal impacts certainly as well, and costs that are being paid right now, but it's usually the workers who are paying those costs of not having a benefit like paid sick days.
And I'm out of time, but it is also society, because when you can't go to the doctor during the workday and you go to the emergency room at night, and it's charity care we all pay. Thank you very much. I yield back.
Thank you. Thank you all very much. I remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing, preferably in Microsoft Word format. The materials submitted must address the subject matter of the hearing. Only a member of the subcommittee or an invited witness may submit materials for inclusion in the record. Documents are limited to 50 pages each. No longer than 50-page documents will be incorporated into the record via internet link that you must provide to the committee clerk within the required time frame, but please recognize that years from now that link may no longer work. Again, I want to thank the witnesses for their participation today. What we've heard is valuable. Members of the subcommittee may have additional questions for you, and we ask that the witnesses to respond to those questions in writing. The hearing record will be held open for 14 days. In order to receive those responses, I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. I now recognize our distinguished ranking member for his closing statement.
Thank you, Madam Chairwoman. I've just read a political article that's come out in the last few hours that says that Speaker Pelosi and Secretary of Treasury Mnuchin are working together on an expanded response to the COVID-19 crisis, and it would include this topic. That's the way you do this, in a bipartisan fashion. That's how we passed an $8 billion appropriations bill last week to address this. You do it by working together. You don't do it by having a completely partisan bill. So I'm hopeful that that conversation between the two of them will yield something that we can all get behind, because that's the way we solve this. But I'm mindful of something Rahm Emanuel said when he was chief of staff to President Obama in 2009. He said, "You never let a serious crisis go to waste." I'm afraid some of us are doing that here. We're trying to use this crisis to get something that's really not directly related to it. Look, paid leave is a good thing. It is a good thing. That's why 75% of small businesses offer it, and 80% of all businesses offer it, because it's a good thing for their employees, it's a good thing for the business. But it's not possible for every business. And maybe there's ways we can help them get there, which we thought we were doing, and I think we did achieve to some extent with the tax reform bill. And I want to do that. I want to help businesses get to the point where it's a good thing for all of them in all circumstances. Unfortunately, some of our small businesses, when they have to make decisions, their margins are razor thin. And they make a bad decision, and it means they shut down their business, and everybody in that business loses their job. So we are highly dependent in this country on literally hundreds of thousands of small businesses to make the right decision so that they don't close down and we don't lose the jobs that they've got. I was there advising small businesses during the passage of the Americans with Disabilities Act and the passage of the Family Medical Leave Act. The enormous burdens that we put on a lot of those businesses, I don't think any of us in Congress or people in Congress at that time had a clue what it was doing to those small businesses. We have to keep them in mind in what we're doing here, and one size does not fit all. Now, don't just ask me that. Go back and read the words of the people that founded this country and put together our Constitution. They understood that this was going to be a very diverse continental nation, And they set a government in place to allow for that diversity, to allow for that flexibility. It's worked pretty well for almost 250 years. I think we can continue to let it go. And so let me just say this about implementation and enforcement. I've been there for implementation and enforcement. That's where you run people out of business. I've seen it happen over and over and over again. Implementation and enforcement can be a good thing where government is working with businesses to help them get to a desired result, or it can be a dagger in the heart. And too often, we're the dagger in the heart. I tell people all the time, if you're a hammer, everything looks like a nail. If you're a regulator, everything looks like it needs to be regulated to death. We've got to find a happy medium here. We're not doing a very good job of it. So I'm looking forward to seeing, Madam Chairman, whatever comes out of the work between Speaker Pelosi and Secretary Mnuchin. And while I'm on that topic, I totally agree with the speaker saying we should be here doing our work. I'm glad we're here doing our work. We should be modeling for the rest of the country what we should be doing in a cautious but totally realistic fashion. And I hope that her work with Secretary Mnuchin can produce a piece of legislation that you and I and everybody in Congress can get behind. With that, I yield back.
Thank you, sir. And I certainly agree with you. And if we weren't here doing our work, we'd probably still be getting paid. But, you know, we got to think about everybody else as well. So I'm glad that that discussion is going on. I recognize myself now for the purpose of my closing statement. Today's hearing confirmed that we have long known the lack of access to paid sick leave in this country poses a significant threat to our economy, our businesses, our workers, and our public health. To tackle the rapid spread of infectious diseases such as the coronavirus, we must learn from the lessons of past health crises and ensure that workers have access to paid sick days now to protect themselves, their families, and our nation. The committee will pursue legislation to immediately protect workers' health and economic security. But as our witnesses reminded us today, this issue is not just about combating global health crises when they arise. Allowing more workers to earn and take paid sick days means that workers will not have to decide between their paychecks and their family's health. And that's life-changing for so many of our constituents, including the people of my district. Catherine Austin, a working mom in my district, said this, and I quote, "I've never once had a job that offered even unpaid sick days. It's rough knowing that if I call out of work for being sick or for needing to take care of my sick child, I can lose my job. I've had to wait tables while vomiting and running a fever because my employer told me I had to come in or I would be fired. I've passed out while working because of dehydration from vomiting. I've had to keep my sick child at home with me because his daycare sent him home with a fever, but my boss said they would fire me if I stayed home with him. Why should we have to choose between our health and keeping our jobs?" End of quote. Catherine Austin represents millions of workers across the country who need Congress to act. We must pass the Healthy Families Act and finally establish workers' rights to earn the paid sick days they need to care for themselves, their families, and their communities. And before we adjourn, I ask unanimous consent to submit into the record a letter led by the National Partnership for Women and Families and signed by over 130 organizations urging Congress to pass the Healthy Families Act. I'd also like to submit the story of Lauren Melton, who needed time off to care for her sick mother and lost her job as a result, without objection. If there's no further business, without objection, the subcommittee stands adjourned.